All right, guys and gals, got 5 questions here, board-style questions. Some of them I've adapted from my own prep resources. Others I just created in the same light and style that you're going to see. So let's just go through them. I'm going to show you that these are very attackable, very easy. All right. A 1-year-old boy is brought in by his father. He thinks that he is developmentally delayed because he had an unremarkable neonatal history up until 7 months ago, when he started to regress. So that's kind of a telltale sign for a lot of these lysosomal storage diseases, even if they don't explicitly say. Sometimes they will. Sometimes they'll tell you the patient was found to have a lysosomal storage disease to help clue you in. But most of the time, if you look at the answer choices, it'll kind of put you in the frame of mind as well. But if nothing else, developmental delay is a big red flag for these type of diseases. So he is not growing as well. He's low percentile for height and weight. Here's the kicker: he has an enlarged liver. So if you remember what I said in the first video, hepatosplenomegaly is not unique, but it is going to help you in the case of cherry red macula. So let's see what happens at the end of this vignette here. He's got a large liver, large spleen, and he's hypotonic. So the doctor looks at his retina. He sees the famed cherry red macula. What does that automatically clue you into? It should clue you into 2 diseases. Which have the cherry hyphen red spot? It's going to be the other hyphenated ones, tay-sachs or niemann-pick. So now I know this boy has cherry red macula. I know he has hepatosplenomegaly. So remember, which of the diseases has hepatosplenomegaly? Niemann-Pick's. Remember, because tay-sachs lacks. Tay-sachs lacks hepatosplenomegaly. Tay-sachs lacks hepatosplenomegaly. All right, so it's Niemann-Pick's all the way. They're not asking you about the disease, though. They're asking you to go a little further. What is accumulating in this patient's body? Now, the Niemann-Pick nose picker picks his nose with a foam finger. So he's picking his nose with his finger, remember? So the answer here is, here, I'm going to highlight it here, sphingomyelin. Boom. All right, next. 2-year-old child failing to meet milestones, again, determined by their pediatrician. Child was walking by 10 months, but has since started crawling. You don't go backwards in development. Red flag, all right? When reaching for toys, there's ataxic movements, and blood tests reveal very low levels of aryl sulfatase A. What's the diagnosis? So kind of like the approach we've been taking is look for buzzwords. Is there any buzzwords in here? Not really, but they give you an enzyme. Okay, so if they give you an enzyme, remember the little stories behind each one. So aryl sulfatase is kind of like the air surfing thing. So remember what happened? Who was trying to air surf? It was the white guy with a tie-dyed t-shirt, a metachromatic t-shirt. So this one is definitely going to be A, metachromatic leukodystrophy. Leuko meaning white for the white guy. That's air surfing. All right, next. A 13-year-old Ashkenazi Jewish girl recently had to stop sports due to recent diagnosis. That's another thing. These, the epidemiology of these type of disorders are commonly seen in Ashkenazi Jews. So that's another clue, another red flag, so to speak. If you can't recognize the frame of questioning by the answer choices alone, usually they'll give you developmental delay, Ashkenazi Jew, or some pretty serious buzzwords. So, her spleen and liver are enlarged, probably the reason that she had to stop sports. She's leukocytopenic and has low red blood cells. She complains that every bone in my body hurts. So there's bone involvement. Which of the following would you expect to be accumulating in this patient? Only one of these. So bone involvement is a buzzword for sure. It's unique to Gaucher's disease, and the way I remember that is because Gaucher's disease is all about the birthday party. What do people want on their birthday? Birthday sex. That's going to be bone involvement. Therefore, it's Gaucher's. Now, it's not giving me diseases in the answer choices, so I have to remember the association with Gaucher's, and I remember that pretty sweet birthday cake full of glucose. Therefore, the answer is glucocerebroside. Okay, two more. Postmortem evaluation. Unfortunately, this patient didn't make it. There's a lysosomal storage disease. Okay, thank you for telling us. An abundance of heparin sulfate was found in tissues. Remember, heparin H goes with hurlers and hunters. So right now we narrowed it down to two. Okay, heparin sulfate buzzword. And the patient's history included developmental delay, 20/20 vision. If that's not enough, they further say no corneal clouding. So that's going to help you narrow it down to one choice. Remember? So we got heparin. We can narrow it down, hurler and hunter. Now, between hurler and hunter, which one has corneal clouding? Remember, a hunter has to have very good vision. Okay? So this is going to be hunter. What is the inheritance pattern of this patient's disease? Oh crap, they didn't ask about the disease itself, they ask about the inheritance pattern. But we know this. So remember, one of the first things I told you about inheritance is these are all very rare. They're all recessive inheritance. But two of them are X-linked. Which one? Hunter, because the hunter aims for the X, or the target. And Fabrics, because we got X. Fabry's, Fabrics. So this is definitely not Fabry's because of the heparin involvement. So therefore, this is going to be Hunter's. And finally, 16-year-old intellectually disabled female is brought in to assess the progression of her disease course, which is typically fatal in early childhood. She's blind. Okay, that's something. Uses her mother to navigate into the exam room. Physical exam. Demonstrates loss of sensation on the plantar aspects of the feet as well as the tips of the fingers. Sounds a lot like a stocking glove pattern, aka peripheral neuropathy. Previous diagnostic tests reveal globoid cells on histology. Buzzword. Remember the crabs with the globoid eyes, little tiny eyes, so optic atrophy. Which enzyme is deficient in this patient? So we're able to tell that this is Krabbe's. They give you pretty much all the classic presentations. Blindness, globoid cells on histology. Now we got to figure out what's the enzyme. So remember the crazy galactic crabs. So this is going to be galactocerebrosidase all day. So you can see exactly if you get through the craziness of the mnemonics and the stories that I was telling in the first video, how useful they are going to be. And you're not going to get 25% of the test being these type of disorders. But if you kind of invest 30 minutes or 40 minutes, you'll probably never forget how to arrive at these things, and you can grab the answer pretty quick in most cases. So thanks for watching.